Paris overdose deaths in the United States have reached an all-time high. According to the Centers for Disease Control and Prevention, more than 96,000 people died of drug overdoses during the first year of the COVID-19 pandemic. That's an increase of almost 30% in just 1 year. It is also the largest single-year increase in drug overdose deaths ever reported in the country. Joining us now to talk about the situation locally are Erica Ernst, President and Interim Director and longtime volunteer at the Chicago Recovery Alliance, and Dr. Maria Torres, Chair of the Pain Medicine Division at Cook County Health and Hospital Systems. Thanks to you both for joining us. Erica Ernst, let's start with you, please. As we just said, the CDC reported earlier this month that drug OD deaths in the U.S. hit this all-time high for the first 12 months of the COVID-19 pandemic. But in contrast, we know the Chicago Department of Public Health reports an 18% decrease in opioid-related deaths in the first half of 2021. What would you say we're experiencing here?
I would say the drastic increase is due to a lot of isolation and tainted drugs, tainted with a large proportion of analogs of fentanyl. The decrease in the Chicago area, I'd say, is due to concerted efforts of many organizations, including ours here tonight.
And you say isolation, as in, people who are using drugs aren't able to access the services that they would typically be able to access?
I think a lot of people are trying to be conscious about COVID and COVID risk, and whereas prior to the pandemic, we'd see a lot of drug users use in a social setting, and now people are trying to be thoughtful about their health. I don't want to go and hang out with a large group using drugs. I'm going to use drugs at home alone, and we know that that's a major risk factor for overdose.
Okay, so that means someone is not there to help them if they get into trouble.
Correct.
Okay.
And we can distribute Narcan widely, but if someone's by themselves, they can't reverse their own overdose.
Right. Dr. Torres, how much of a factor is the pandemic in this surge in overdose deaths, and what impact is it having on drug use?
Certainly many aspects have been impacted in patients, both with chronic pain syndrome, psychiatric illnesses. The pandemic has deterred a lot of office visits. Our primary care providers were truly at the forefront of evaluating, diagnosing, and treating these patients. And unfortunately, secondary to COVID and its isolation and barriers, this has been a major key factor.
Erica Ernst, the CDC says that opioids are the largest cause of overdose deaths, and that as you mentioned, the synthetic opioid fentanyl causing a lot of those. How are the people that your organization serves, how are they first getting exposed and then hooked on opioids?
Most of the folks we end up working with have pursued street level drugs directly, as opposed to the often communicated idea that they were initially on pain pills, went to pill mills, were hooked on oxy, and then went to street level drugs. A lot of these folks are homeless, street-based in the first place, and fentanyl is more recently, it comes in ebbs and flows over time, but this most recent couple of years, fentanyl is the only thing that's out there for the most part, and it's also tainting a lot of the other street level drugs. We're seeing it come up in the coke and the meth and a few other things.
Dr. Torres, why is fentanyl so ubiquitous, and also why is it so dangerous?
Fentanyl is a unique drug, is a very potent opioid, and it has been used for many, many years, but the potency of it makes it extremely dangerous to that patient that doesn't really know the quantity. Additionally, I totally agree with you that fentanyl is a major opioid offender, but it is not pure fentanyl either. There's been a lot of laced, a lot of other psychomimetic drugs that are, and psychedelic drugs that are now involved in this too. I think you asked a question previously of what have we seen here locally? And I think Erica is really right on the issue, because the major initiatives that we, and that's across the health system, have taken, from pharmacy to medical team to nursing to IT, implementing a lot of the tools that help us better diagnose, and the access to substances that can truly modify patients' pain, if that's the issue that we're using it for, or their drug use. Naloxone has been truly a game changer in our group.
And to that point, naloxone, though, there have been some reported shortages, and naloxone is the overdose reversal drug, Narcan. Some people may have heard of it, but there's been a shortage in some states. Erica, has that been an issue here?
Yeah, the shortage is with the primary distributor and being able to distribute it at a cost-effective rate. So the naloxone is the generic injectable, and that is what Chicago Recovery Alliance has been at the forefront of distributing to drug users and their loved ones outside of medical auspices. And at the current, we have good funding to distribute naloxone. However, we've had to buy the more expensive nasal Narcan, which is a difference of about $50 a kit, which a kit is for one person's overdose.
So $50, that's a significant amount, obviously, if you're an organization that needs to buy it in large amounts.
Correct. So the shortage is nationwide. Luckily, right now we have a supply sufficient for our folks, but traditionally CRA distributes nationwide and ships out naloxone to help the smaller orgs. And right now we can't do much of that.
Okay. We'll have to leave it there. My thanks to Erica Ernst and Dr. Maria Torres for joining us.
Thank you.
Thank you.